Ostina Gamo has had tough time keeping a balance between her work as a nurse and family.
Things been very hard for now because I live in Burkina Faso. I'm the call 24 hour. They call na house. I'm the they do. They say they do fine. I go left duty. I go on for Burkina Faso. I go take care of Burkina. What is
This has changed now, as the Princess Christian Maternity Hospital, where she works, has just got a lactation room for its staff.
We want to see all the hospitals having similar structures and spaces like this to help nurses to work, to be efficient in what they do while their children are also being protected. Having said that, I want to officially hand over or open this particular project space for our children and women.
This room offers a private space for female employees of what is Sierra Leone's largest maternity hospital to breastfeed their babies and have them cared for while they are on duty. It's the first of its kind in the country.
We want to see all of our follow suit because for me it is very important to do exclusive breastfeeding, and because it will help protect the health of our babies.
The room, which was inaugurated on Friday, August 1st, is an initiative of the Scaling Up Nutrition and Immunization, or SUNI Sierra Leone.
The establishment of this workplace lactation room is not just a symbolic gesture. It is a practical and strategic investment in the health and productivity of our female workforce, especially those balancing demands of their professional and maternal responsibility. And some of whom will be born, will go school, will be home. And we don't turn for other individuals who have this opportunity.
I think we should think breastfeeding beyond gender. It is a decision making of a mother, and we should provide every support to the mother. It took a long, but there is never a late for a good decision. So I congratulate all of you for all of your these things, but I would like to see a breastfeeding room in Ministry of Health. Thank you very much.
The SUN movement aims to end malnutrition, which is a major public health issue across the world. The country-led campaign brings together governments, civil society, the United Nations, donors, businesses, and researchers to work towards improving nutrition outcomes. It follows a coordinated multi-stakeholder approach with a particular emphasis on the first 1,000 days of life from pregnancy to age 2. In Sierra Leone, the SUN movement is coordinated by a secretariat housed within the office of the Vice President.
Of the workplace lactating rooms embodies our shared commitment to building environments where women can thrive professionally and personally. For countless female workers juggling their official duties and caregiving roles, the availability of dignified, functional lactating spaces is not a luxury, it is a necessity.
The SUNI Civil Society Alliance, also known as the Sierra Leone SUNI Civil Society Platform, is a key component of the SUN movement, and it is currently chaired by the local NGO Focus 1000.
An enabling environment to support mothers to be able to breastfeed, do exclusive breastfeeding and continue breastfeeding up to 2 years. So we're really happy that Chilean Advocacy Forum led the Civil Alliance to be able to have that pilot workplace lactation program at the Princess Christian Maternity Hospital. So we're really glad because it is one of the things that we're meant to do under the Breast Milk Substitute Act that was enacted in 2021. So that is to provide, to help mothers, working mothers especially, who have to come back after their leave, after their maternity leave. They have to come back to the workplace. So how do we support them to be able to continue with exclusive breastfeeding?
Definitely, what we did is a symbolic, presentation of our commitment to call stakeholders to action to ensure that we have these policies in place that will make provision for the establishment of these lactation rooms.
The establishment of breastfeeding workplace breastfeeding unit is very transformative because it is going to impact care that we provide. When we consider the fact that the majority of our health workforce are female, some of them go through pregnancy and childbirth, and those early stages of nurturing their babies, they have to juggle between care for the babies, breastfeeding, and then work. Now, combining these is indeed a very arduous task for an average woman. But I must commend all of them, for the tremendous effort that they have been putting over the years, going through all of these challenges.
Malnutrition affects both developed and developing countries, and it has far-reaching consequences, impacting health, development, and economic productivity. Sierra Leone's multi-sector strategy to reduce malnutrition is aligned with national and international goals, with emphasis on an integrated approach addressing food access, maternal and child health, and sanitation. A critical aspect of this is improving breastfeeding, especially exclusive breastfeeding.
And give the breastfeeding to the child, which is part of the development. If we are talking about the development of the child, the brain, that first 6 months to 2 years, it plays 80 to 90% because it's where the brain starts to develop. So if you really need to combine, you are really able to give that exclusive breastfeeding, and then the complementary comes in. At least from 0 to 2 years, then you will see yourself how your child will be developed, how economically you'll be able to save your resources.
The inauguration of the PCMH Lactation Room marks the beginning of the commemoration of World Breastfeeding Week 2025. The week-long event that runs from August 1 to 7 serves as awareness-raising platform on exclusive breastfeeding and its importance in the fight against malnutrition. While exclusive breastfeeding rates have improved over the years in Sierra Leone, a significant percentage of children in the country still suffer from malnutrition, including stunting and wasting, according to official data. The government and its partners have implemented several initiatives geared towards addressing the gaps. Among these was the enactment of the Breast Milk Substitute Act in 2021, which was designed to promote and protect breastfeeding while regulating the marketing of breast milk substitute. The PCMH Lactation Room project is a pilot initiative targeting 3 sectors: a health facility, a marketplace, and a private company. The goal is to expand the initiative to every workplace across the country. This is no small ambition. Even for PCMH, which is just one of 2 components that make up what is known as cottage hospital, the 10-bed lactation room is just a drop in the ozone. The maternity hospital alone has over 300 female workers, according to management. When you add that to staffers from the adjacent Oladurin Children's Hospital, it becomes even more overwhelming. But for these nurses, this is a time to celebrate what is on hand.
Long years ago, we've been looking forward to a room to be created for our nurses that are breastfeeding mothers to be created at PCMH. Because we have nurses here who are breastfeeding, and at the end of the day, they come for work and leave their babies at home. They do not do the work perfectly because their minds are at home, thinking of their babies and thinking of the work they are doing.
Breastfeeding for that baby. I'm not saying I want to. So you eyes them, they are you.